Okay. Good morning, everyone. I'm Vicky Paris, and I will talk to you about the role of acupuncture in management of infertility and assisted reproduction, especially in vitro fertilization (IVF). From a Western medicine perspective, we're gonna talk firstly. Infertility refers to a condition affecting either the male or female reproductive system, characterized by the inability to conceive after at least 12 months of consistent unprotected sexual activity. It can be attributed to male-related, female-related, or unknown causes, and it can be attributed, in some cases, infertility stems from preventable factors. This study is going to analyze the causes, the pathophysiology, and the therapeutic approaches of infertility, specifically for women. So in women, infertility may result from various conditions affecting the reproductive system, such as fallopian tube abnormalities, uterine abnormalities, ovarian dysfunctions, and endocrine disorders that disrupt hormonal balance. In addition, some lifestyle factors such as smoking and excessive alcohol and obesity may affect the fertility. And also exposure to environmental pollutants and toxins can be directly toxic to gametes, eggs, and sperm also, resulting in their decreased numbers and poor quality. Large numbers of people are affected by infertility in their lifetime. Around 17.5% of the adult population experience infertility. That means 1 in 6 worldwide. The prevalence appears similar across countries, regardless of the income level, either it is high, middle, or low. And that highlights that infertility is a widespread global health concern. The prevalence was estimated at 17.8% in high-income nations and 16.5% in low and middle-income ones. There are many therapeutic approaches to infertility in Western medicine. The most common treatments include the in vitro fertilization and other forms of assisted reproductive technologies. But according to the etiology and the differentiation between male and female infertility, other approaches can be applied. Some of them are pharmacological treatment, surgical treatment, supportive interventions and psychological support, and assisted reproductive technologies that we already said. Now, from East Asian medicine perspective, in traditional Chinese medicine, TCM, fertility is understood not merely as a function of the reproductive system, but as a dynamic expression of internal balance between qi, blood, essence, and the functional activity of the Zhangfu organs, particularly kidneys, liver, and spleen. Syndrome differentiation in TCM is based on the comprehensive analysis of clinical information that are gathered through 4 diagnostic techniques: the visual observation, listening and smelling, the distinct method of pulse examination, and the patient inquiry. All these are aimed at identifying the underlying nature of the disease. There are several common patterns associated with female and male infertility. Some of them referring to the female infertility include kidney yang deficiency, kidney yin deficiency, kidney essence deficiency, liver qi stagnation, liver blood stasis, and cold in the uterus. In TCM, the treatment of infertility, both male and female, is fundamentally rooted in the principle of restoring the internal balance. And that is happening through regulating the flow of qi, nourishing blood, supporting the essence, and harmonizing the Zhangfu organs. Treatment modalities may involve acupuncture, herbal medicine, moxibustion, dietary guidance, and qigong exercises. Among these, acupuncture is the most extensively researched, and commonly utilized method, especially in the context of assisted reproduction. Now, according to TCM, acupuncture addresses different pattern-based diagnoses. In kidney deficiency syndromes, yin or yang, acupuncture tonifies the kidneys and nourishes the essence. For liver qi stagnation, acupuncture promotes the free flow of qi and calms the mind. And in cases of blood stasis or cold in the uterus, acupuncture invigorates circulation and dispels cold. Now, acupuncture is frequently integrated into IVF protocols, particularly during the follicular phase around ovulation and immediately before and after embryo transfer. Now we're going to see some researches, meta-analysis, and clinical trials that studied this thing. Firstly, we have a meta-analysis by Sen et al. In 2015 that showed pooled benefit of acupuncture for IVF when performed at follicle phase and 25 minutes before embryo transfer and 30 minutes after embryo transfer. One clinical trial of Balk et al. In 2010 studied 57 patients undergoing IVF. Each patient in the experiment group received an acupuncture treatment 25 minutes before and after embryo transfer. The results showed that women who underwent the specified acupuncture protocol exhibited a pregnancy rate of 64.7% and lower stress scores, in contrast to a 42.5 rate among those who did not receive acupuncture. The points that were selected in this clinical trial are those that you see on the PowerPoint. Before embryo transfer, they chose the points pericardium 6, spleen 8, liver 3, do 20, and stomach 29. And after embryo transfer, the acupoints that were selected were stomach 36, spleen 6, spleen 10, liver 4, and auricular acupuncture in ear points, Sen-Men, Zigong, Neifenmi, and Naudian. In 2018, Smith and al. Conducted a randomized clinical trial involving 824 women undergoing IVF. The acupuncture protocol consisted of 3 sessions. The first one was between the 6th and 8th day of ovarian stimulation, the second on the day of embryo transfer within 1 hour before the procedure, and the third one followed the embryo transfer. The results showed that there was no statistically significant difference in live birth rates. The points that were selected in this clinical trial were those that you see in the PowerPoint. In the first session, we have points stomach 29, REN 4, REN 6, spleen 6, and spleen 10. On the second session, stomach 29, spleen 8, spleen 10, liver 3, REN 4, and one of the next acupoints, heart 7, pericardium 6, yin tang, and auricular point zigong. And the third session, for the third session, we have do 20, kidney 3, stomach 36, spleen 6, pericardium 6, and auricular points and men. Now, in 2019, Gillerman and al. Conducted a randomized controlled clinical trial involving 157 women undergoing IVF. The protocol that was used was the same as the previous clinical trial, but the results showed that there was a higher live birth rate and positive pregnancy rate in the acupuncture group compared to the control group. These are the points that we already talked about. And at last, we have a meta-analysis of Wang et al. 2022, who included 10 studies. The results showed that there was a considerable variability among the findings of in the individual trials. These variations in the results can be attributed to several methodological limitations, such as differences in the timing of acupuncture during the IVF cycle, the variation in the acupuncture points that were selected, that acupuncture was not performed by experienced licensed acupuncturists, and there was lack of TCM diagnosis and fixed protocols that caused biases. In conclusion, although acupuncture demonstrates potential as a supportive intervention during IVF, especially in reducing stress and enhancing uterine conditions, it cannot yet be universally recommended as a standard part of fertility treatment without further high-quality standardized research. Future studies should aim for rigorous design, transparent reporting, and clear differentiation of acupuncture components to better elucidate its true therapeutic value. Thank you for your attention.
Thank you, Vicky Papaparisi,